New this afternoon at 4:30, while coronavirus is known as a respiratory virus, studies show it can impact the entire body, including the nervous system and brain. Neurological symptoms reported with COVID-19 include loss of taste and smell, headaches, all kinds of things, and it could be long-lasting. Researchers say they need more rigorous research. And joining us right now is Dr. Avindra Nath, the clinical director of the National Institute of Neurological Disorders and Stroke. Doctor, thank you very much for being here.
Thank you very much for having me on your show.
You know, we mentioned some of the symptoms right there. Talk a little more about the effects COVID has on the brain, because I don't think we hear about this a lot.
Yeah, so it can affect the brain in a variety of different ways. When the patient is acutely ill from the illness, it can actually cause strokes in some individuals, sometimes large strokes or mini strokes. There can be lack of oxygen to the brain, and that can cause damage because of the effects on the lung. Then there can be a metabolic injury because of damage to all the other organs, like the kidney, the heart, or lung failure. And then lastly, you can get immune-mediated injury also in the acute phase. And then you have these long COVID symptoms, which is patients recover from the acute phase of the illness, but then complain of a variety of different neurological complaints. And you can broadly categorize them into 4 different subtypes. First, some people complain of difficulty with memory, concentration, or mood problems like depression. Others have difficulty with exercise, and they complain of fatigue. In fact, one person I talked to, they said they took a flight of stairs up to their first floor, and they couldn't function for the rest of the day. They were just so fatigued. Then some have autonomic dysfunction, which means that they stand up, they feel dizzy, or their heart just races without control. Some complain of peripheral neuropathy, like symptoms, they are tingling in their hands or feet. And then there are a variety of pain syndromes that people can get: chest pain, headaches, intractable headaches,
You know, Doctor, I
or
think
neck pain.
it goes to the heart, really, of what we've been dealing with for the past couple of years now, is that there's so much about this that we don't know, right? Are there ways to treat these symptoms? How do you go about helping these people?
Yeah, so the first thing is to make sure there isn't some other underlying condition, because what can happen with an acute infection is that you may be unaware that you have some other disease like diabetes or what have you, and maybe they can get unmasked. So I think it's important to make sure somebody looks to make sure there isn't some other treatable condition. The second thing you do is you treat symptomatically. So a lot of symptoms can be treated. Heart racing can be treated. If you have pain, that can be treated, and so on and so forth. And then lastly, what you want to do is, I think there's a lot of evidence to suggest that there's immune dysfunction in these patients. So a variety of immune modulatory drugs are available. However, currently we need to do clinical trials to find out which are the right ones in order to use them. And there are a number of trials coming up now,
Well,
including ones that we are doing.
There is still so much to learn, and I'm sure that, with your expertise and the doctors and researchers you work with, we will continue to make some progress. Dr. Avindra Nath, thank you so much for joining us this afternoon. We appreciate your time today.
Thanks very much for having me on your show.